Welcome to ABELDent Paperless. My name is Kel McKay and I'm the Training Manager for ABELDent. In the next few minutes, we'll talk about going paperless. We'll talk about what paperless actually means, discuss 3 different methods for going paperless, and some specific tips for getting your practice to go paperless. So what is paperless? A lot of people say there's no such thing as paperless because you can never get rid of all the paper in your dental practice. Well, that's true. You'll still receive letters from insurance companies and specialists, and you'll still need to print some insurance forms and print receipts for patients. So does that mean then that it's not paperless? Well, the term paperless often really just implies chartless. For the purpose of today's video at least though, we'll call it paperless. Now you may ask, how can I go paperless? Is there a right way to do it? And the answer is, of course, it's the one that's right for you. Now there are 3 strategies for going paperless that we're going to talk about today. That's the quick, the analytical, and the combination method. First, the quick transition method, otherwise known as cold turkey. In this method, the practice scans every paper from every patient's chart into digital form in a very short time, usually by using a scanning service. And this means the practice can literally go paperless overnight. The analytical method, or the slow but sure method, is basically the other extreme of this first method. The dental team will need to review each chart in detail and then decide what, if any, of the existing paperwork needs to be scanned into the electronic record. While this means that all the required information and only the required information from your charts gets transferred, it does, however, mean that you have to spend a large amount of effort in a short period of time to achieve the desired results. And finally, the combination or the hybrid method, this is a nice happy medium between the previous 2 extremes. In this method, you digitize only what you need and go paperless 1 patient at a time, beginning with, say, new patients. Now, what do I need to get this going? Well, if you are already an ABELDent customer, all you're going to need is some training. If not, you need to ensure that your software conveniently supports paperless practice and then act accordingly. For ABELDent customers, the front desk is going to need only about an hour or so of training just to be able to know where to find information on a patient who suddenly has no paper chart. Clinical staff, however, will need approximately 4 hours of training to start with, and then a follow-up session about a week or 2 after you start using it. Since ABELDent already has full paperless capability, there's absolutely no need to buy additional software or some new module. In fact, ABELDent users have been going paperless for about a decade now. You would, however, need new ABELDent licenses for any workstations in the operatories if you don't have them already. Regardless of the method that gets chosen, there are a couple of challenges that practices usually face when they're going paperless. The first is leadership. To be successful, each office needs a champion of change to help lead the implementation and overcome staff resistance. Now this can be anyone, but someone with some authority, like say the practice owner or the office manager, ends up working best. The other challenge you have is time. You need to take enough time to make this successful. It is hard for some people in the practice to accept that you have to invest some time up front in order to save time every day in the future. And lastly, it's always good to have team meetings to discuss your plans to go paperless. After all, the most successful implementations of paperless tend to occur when the whole team is involved right from the beginning. Now, if you're one of those offices that's just raring to acquire ABELDent for your practice, or you want to set up paperless training for your existing ABELDent practice, just call the number showing on your screen and talk to us about it. Have a good day.